Varicose veins have been around as long as the human race. This Roman temple carving is about 2,000 years old and shows a typical varicose vein in the correct anatomic location. Now, your leg veins are nothing more than rubber-like tubes that carry blood from the body back to the heart to get replenished with oxygen. Our legs have two parallel systems of veins. They are connected together in only a few places. There's a superficial set located beneath the skin but above the muscle, and these are the veins that become ballooned out or varicose. There's a deeper, more important set of veins that carries 90% of the leg blood and is mostly located underneath the muscles. Now, blood from the skin and the fat underneath the skin is directed into the deeper veins through the saphenous veins or other small connecting veins called perforators. One-way valves keep the blood flowing up to the heart from the skin down through the deep veins. These valves look like upside-down parachutes, and simply put, varicose veins are nothing more than a consequence of valve failure. As you can see, with increased pressure, such as with weight gain, pregnancy, prolonged standing, the walls of the vein can stretch out, and if there's a genetic predisposition for weakened vein walls, a valve can spread apart and then fail. This causes a domino effect, and now all the pressure is down on the next valve. And if a valve fails that's directly above a branch, then that branch segment will dilate out and become varicose. When this happens to tiny veins, spiders develop in the legs, and with larger vessels, typical ropey varicose veins develop. Modern treatment of varicose veins lets us precisely identify the source of the failed valve, and best results come from both treating the cause and the veins themselves. Recent developments in ultrasound have allowed us to visualize these veins in a magnified form directly underneath the skin. With ultrasound, we also look for perforating veins, as they need to be treated if they're the source of the varicose vein problem, or the veins will never disappear or recur rather quickly. Some people with varicose veins are fortunate enough to have no symptoms except for a disfiguring appearance. But if and when the veins grow large enough, typical symptoms are heaviness, tiredness, throbbing, itching, and cramping, especially after prolonged sitting or standing, with relief usually following elevation or a good night's rest. If a varicose vein develops directly over a nerve, this can cause burning or shooting pains, and until the vein is removed or dealt with, those symptoms will only worsen and not go away. Increased pressure in the veins from the varicosities can cause swelling or edema of the legs. These veins can also rupture and cause significant bleeding. If that happens, lay down, elevate the leg, and use a washcloth or something to hold pressure over it. If you have an ace bandage, wrapping with that will also control the bleeding, but virtually all bleeding will stop with pressure. As the water is pushed out of the varicose veins, it is accompanied by red blood cells, which are rich in iron. And as the water is reabsorbed, the red blood cells stay and end up staining the skin a rust color. The skin then can thin out and eventually break down, causing ulcerations which are extremely difficult to heal. This unfortunate patient came to my office with a 9-year history of this sore on his leg that just would not heal. I attempted to clean it up with medications and local wraps, but after 2 months, this was the best I can do. But once I treated the feeding veins into the area, within 5 weeks, the ulcer that had been present there for over 9 years completely healed and has remained healed since.
If you've ever had any trouble with varicose veins or your legs breaking down, he is definitely the guy to see. He's done a wonderful job on mine. I've been to doctors off and on for the last 10 years at least, and they would get it to momentarily heal for a little bit, but never the stuff that it's going through now, never completely healed like he has gotten my leg to heal. It's really nice not to have it cramping up like it was doing before. He really knows what he's doing, and he's the guy to see. if you've ever had any trouble with varicose veins or your legs breaking down.